Every day, many women suffer from postpartum depression, which is left undetected for various reasons, including lack of screening during and after pregnancy. Such is in the case scenario with Mia. Mia is a 35-year-old healthy first-time mother-to-be. She's been happily married to her husband of 5 years. Together, they are excited about expecting their first child. Mia has no previous health issues except a history of depression and generalized anxiety, which has been controlled by diet, exercise, and cognitive behavior therapy. Her pregnancy has been without any complications, and she has maintained a positive attitude with no symptoms of depression or anxiety. Mia sustained her weekly exercise and therapy regimen during her pregnancy. Mia was never screened for any risk factors for postpartum depression. Mia gave birth to a healthy 7-pound, 13-ounce baby girl. While in the hospital, Mia began feeling an overwhelming sense of sadness and started having abnormal thoughts of harming the baby, which created panic and anxiety. Although she had had the support of a loving family, she often felt alone in her thoughts and cried often. This continued even after leaving the hospital and being in her own environment. Mia finally opened up to her husband about her feelings and thoughts she'd been having for a while and made an appointment to see her doctor. While at the doctor's office, she was screened for postpartum depression using the postpartum depression screening scale and was prescribed a safe antidepressant to use while nursing. After a few weeks of taking the antidepressant, she began to feel better and her negative thoughts started to subside. Mia began to enjoy motherhood and smiled often. Mia's case is all too familiar with women who have postpartum depression and feel shame and fear. Most women expect that having a baby would bring happiness and excitement, yet the experience can be far from it. Many new mothers actually experience some form of postpartum mood change known as baby blues after they give birth. This can include crying, mood swings, anxiety, and fear, which can last a few weeks. However, postpartum depression can last a lot longer with more severe symptoms. Postpartum depression or baby blues isn't something that new mothers can prevent or change on their own. That's why it's important that mothers are screened throughout their pregnancy and after childbirth to ensure the identification for risk factors and proper treatment for postpartum depression are identified. Both the postpartum depression screening scale and the postpartum depression predictors inventory are used to identify risk factors and symptoms for postpartum depression, which will be discussed on the further slides.